Hello, everybody. My name is Maria Mercedes. Today, I'm going to talk about mental health in different cultures, psychological disorder in different cultures. Kikikomori. The disorder is characterized by the voluntary absence of social interactions outside of family members, including not participating in a school or a job, appears in adolescent Japanese students. THT syndrome, most common in South Asia, in which men develop morbid anxiety about concerns that they are losing vitality. Koro, most common in South and East Asia, in which men develop morbid anxiety and fear that the penis is restricting into their body. Ataques de nervos, most common in Puerto Rico, in which emotionally charged incidents cause convulsions, loss of consciousness, heart palpitation, and a sense of the heat rising to the head. Amok, most common in Southeast Asia, in which a person has a sudden outburst of unrestrained violence, followed by exhaustion and amnesia. Frigophobia, most common in China, known by a morbid fear of getting cold. Susto, most common in Latin America, a person feels that the frightening experience has dislodged the soul from his or her body. Voodoo death, most common in Africa, a person has been cursed or has broken a taboo, resulting in fear that sometimes leads to death. Eating disorder, anorexia nervosa, a refusal to maintain a normal weight, an intense fear of getting weight or becoming fat. Bulimia nervosa, an eating disorder characterized by recurring episodes of binge eating, prevent weight gain, including vomiting. Universal conditions. First, depression. Depression is most common in the West. Symptoms are sadness, futility, and loss of energy. If this severe, become a major depressive disorder. Social anxiety disorder. A fear that one is in danger of acting in an inept and unacceptable manner, which will bring disastrous social consequences. Schizophrenia. A debilitating mental disorder. Patient might have two or more symptoms: delusion, hallucination, speech, grossly disorganized, or catatonic behavior. Suicide. Suicide is one of the most tragic consequences of mental illness. It occurs at different ages in different countries. This graph shows that in Micronesia is the highest rate of suicide of teenagers and young people. On the other hand, in Hungary, the highest rate of suicide are for people over 65 years old. In America, it shows that the rate is flat between ages of 15 and 70 years old. Cross-cultural mental illness treatments. We have social support, psychotherapies, multicultural therapies. Since the treatment of mental illness varies across cultures, therapists strive to achieve cultural competence. Thank you for watching. I hope this presentation gave you better insight into mental health. Always ask for help when needed.